Ke. My name is Evelyn Gewa.
I'm Erin Guru. Back to our studio. Welcome, people. Thank you for the way you've supported us. Thank you for all the old subscribers. Keep subscribing. For the new people, welcome to our channel. Let us run. Please comment,
Share and leave a suggestion. Yes, so today we are coming back to you with a very interesting topic. A topic that I'm sure most of you will enjoy and will learn from it. We are going to look at what to look up on a baby after discharge. What to look out for on a newborn after the discharge from the hospital.
Yes, as we always say, the mother is the first doctor of your baby. Like when you're given your baby by your midwife, by obstetrician, it's your role to know how a normal baby looks like.
Yeah, or how a normal baby should be.
Or how, yes. So we take it upon ourselves as mothers to know our babies are okay. Like, know your baby has, how do the eyes look? Whenever you are told by your pediatrician, by your midwife that the baby is okay. Know the baby has 2 eyes. Don't just be told. It's good for you to see for yourself. The nostril, how the baby looks like. You have 10 fingers, 10 toes. You have a patent anus. The baby is passing urine.
Is a boy or girl?
It's a boy or a girl. The skin. Do we have any birthmark at birth?
The cord. Is it well clamped?
Is it well clamped? So once you're given your baby like this by a midwife, your role is to examine your baby. Look at your baby, admire your baby, see that creation. And then from there, you'll notice, like you can just notice, like our baby Nana has a mark. So I'll always, ever in his life, he'll always have this mark. It's a birthmark. Okay.
So there are some of the things. Now, you've been with the doctor in the hospital for 2 to 3 days. You were told the baby is okay and fit for discharge. Now you're at home alone with the baby. There are some things you need to check. There are some things you need to look out on so that your baby can stay healthy both in the hospital and at home. So our first point will be when you have your baby, you should check, is the baby breathing well? Is the baby breathing? Is the breathing okay? What do I mean when I say is the breathing okay, Mary?
Is it regular? Regular, is the baby getting air hunger? Like, are we really struggling to get the air in? Are we using a lot of energy?
Are we struggling?
Is it coming automatically or are we struggling? Like when we say it's a regular breath, when you look at me, and you had seen your baby when baby is breathing normally, and then now this baby starts
fast breathing, like the baby is struggling to breathe, not getting enough oxygen. This is something to look out.
And also, like when you notice even the baby is flaring. What is nasal flaring?
The expansion and it's like the movement of the nostrils.
You find the nostril is moving up and down when the baby is breathing. So those are some of the things that if you notice the baby is breathing fast, and sometimes
they can use the muscles. Especially a baby who is struggling. We'll show the inward pulling of the muscle at the chest, under the ribs.
Under the ribs here. So it will go deep.
And that is called chest indrawing. When you check on that and you see a baby has chest indrawing, it is good to realize that that is not normal and a baby needs to be checked by the doctor.
Sure. And then also, as you're given your baby, you're told your baby is normal again. The color, what is the color of your baby?
The color of my baby should be...
A normal baby.
Should be pink.
Yes. So if your baby is not pink, what other color that can you find with a baby?
Okay, for a baby who is not pink, maybe you can get a baby who is bluish. We call it dusky. And maybe a baby who is yellow. For dusky or blue, You will find the blueness on the lips and on
the lower extremities.
The extremities, yeah.
That when we talk of extremities, we mean the hands, the legs, like on the fingernails, and mostly the hand.
Yeah.
So you find the hands either are blue. There are many causes that would cause baby to be bluish.
Yeah.
One, it's if the baby is not getting enough oxygen, like if you found your baby is breathing fast and you find the extremities are blue, that is the legs, the hands, and the ribs are blue. That means your baby is not getting enough oxygen. That's a candidate to be taken to the hospital as fast as possible.
And even a baby who is exposed much to cold, maybe the baby is in a cold place. Remember, the first thing that a baby needs after birth is warmth. So if a baby is exposed to cold, they may take that blue color, the dusk color, and it will go maybe with warmth. If you see a baby who is blue, you've covered the baby very well, and the baby is breathing very well, then you need to take the baby for other checkup, because it might be more of what we know. It might be something like cardiac.
Yeah.
Okay.
Or any respiratory disease.
Yes. The next color will be jaundice. The yellow color.
The yellow color.
That is called
the jaundice.
Yeah.
The yellow color, you are likely to find it on the tongue.
Yeah, and the eyes.
The eyes and the lips around and on the nails.
Yeah.
So most babies get jaundice, but the levels vary at birth.
Yeah.
So it's upon every mother
to know that
babies get jaundice.
Yeah.
And it's not very unusual.
Yeah.
Like to see your baby with jaundice. Sometimes the jaundice can just be treated by
the basking, exposure
to the sunshine. But when we say you take the baby outside to the sunshine, don't take your baby when the baby is overlapped.
Yeah. Expose the baby.
Expose the baby. You can just have an easy flannel and the baby wears light clothes.
Yeah. Maybe a diaper and a vest.
A vest.
With no socks.
Yes.
Yeah.
That should happen, not with a scorching sun.
Yeah.
But
early morning, at around 10.
Yeah.
And then in the evening at around 5, when the sun is not too hot.
Not too hot.
And
there's no wind.
Yeah.
So that way you will have helped the baby to get the vitamin D, and you have prevented the jaundice. It's a normal occurrence, especially with mothers who are blood group O.
Yeah.
So it's advisable for all the mothers, before you give birth,
just know your blood
group.
Yeah. It's good to know your blood group and your partner's
blood group. Yeah. Because there is what we call Lester's incompatibility.
Yeah, ABO incompatibility. Yeah. So maybe we can clarify to them. There's a jaundice that comes before 24 hours.
Yeah.
And jaundice that will come after 24 hours of baby's birth. What can we say about that?
For mothers with ABO incompatibility, jaundice mostly tend to set in within 24 hours after birth.
Yes.
It's normally serious.
Yes.
Then there are these others that we call physiological jaundice.
Yes.
When baby is in the uterus, the baby tends to have high levels of red blood cells.
Yeah.
Because remember, the baby doesn't breathe by herself or himself.
Yeah.
So he gets the
blood from the mother.
So the baby is well equipped with high red blood cells.
Yeah.
So when they get out and now there is ample of oxygen outside here, some of the red blood cells are broken down and then eliminated through the liver.
Yeah.
So some babies are not really able to eliminate
everything.
Yes. So they show some traces of jaundice within 72 hours.
Yeah.
So that day you may find your baby has
yellowness.
Yellowness.
Yeah.
So how do you deal with it? That is the one that we were saying. Take the baby out to the sun. Or also take the baby, you also breastfeed. So as the baby passes urine,
they bring out there.
You find even the urine is yellow. So breastfeeding is very key, or dehydrating the baby is very key. Then what is the other cause of jaundice? Infection can also be
a cause.
A cause. Remember, this newborn baby has a low cord. So most you'll find this cord may have some infection or even systemic infection.
Or maybe the baby was born with an infection.
So this could also cause
infection.
Could also cause
jaundice.
Can bring about jaundice. So there are those three causes. We have said infection, ABO incompatibility, and physiological jaundice. So for incompatibility, that one needs...
It's handled in the hospital.
It's usually handled in the hospital.
Because it happens when the baby is still in the hospital. And that one is treated medically with the doctor on board. So having done the color, we need to go to the next point, which is feeding. A baby, after the baby is born, they can only be sustained by food. And at this time, food after birth is the breast milk. So for a baby who is feeding, should be noted by the mother. If a baby is feeding well, or a baby is normal with the feeding, should be able to feed between 8 and 12 times a day. Or every 3 hours. Every 3 hours a baby should feed, and they feed on demand. You don't need to.
So you don't have to wait for the 3 hours to be over for you to feed the baby. So you can feed them once. Even if they demand to breastfeed hourly, you breastfeed. That's also in order.
So can we say that it is not okay for a baby who, after 3 hours, a baby who is not able to feed, or a baby who is not, how do we know a baby is ready to feed?
Most of them, they will be cranky. They wake up crying. They will also follow things, and they start biting even their fingers. And even
eating what is next to them.
Like you touch the baby and it's just to suck your fingers or the clothes around.
So once you've noted that the baby is ready to feed, and the baby has fed every 3 hours, 2 to 3 hours, and has had like 8 to 12 feeds, then that's okay. If a baby is not feeding well, then that might lead to very dangerous situations like dehydration, and that needs to be checked by a doctor.
And now, how do you know that? Now, remember, we are breastfeeding. How do I know that I'm feeding? Because you see, when I'm breastfeeding, I can hardly measure the amount of feeds that I'm feeding to this baby. So the only way to tell that this baby is getting full is by what amount are we passing out. What is getting in
should come out.
So baby should pass urine every
3 hours.
Every 3 hours. And for the stool, if we are only doing breastfeeding, the stool we can do even after 72 hours, within 72 hours. But those are the only mothers who are
breastfeeding. For a mother who is not feeding, 3 days are many.
3 days are many. If you're feeding with probably formula or other feeds. But I believe it's either we are doing formula or breast milk.
So you want to tell me that a baby can have a bowel movement after every feed, and that is okay?
That's very okay.
That's what I wanted to clarify.
After every feed, and that is
still okay.
That means that we are just getting more than enough.
So our next point will be, is our baby active? How can we measure activity of the baby?
Sorry, there's something I needed to clarify. When you're still there at the feeding, so if you find your baby has not passed urine, because this is a very common occurrences these days. Like you find a mother going home with a baby, 6 hours, no diaper change.
Yeah.
What should I do? What should that mother do?
And
tell the viewers what the baby is breastfeeding.
Yeah.
Probably the mother has a problem with the latching technique.
Yeah.
So probably the baby is not getting enough.
Yeah.
And this baby has done 6 hours, has done 12 hours, no susu, no diaper change.
Then that shows us that the baby is not getting enough milk.
Yeah.
And that might
what would you advise that mother?
Take the baby back to the hospital.
Or
look for a way to stimulate breastfeeding, or even supplement.
Express.
Yeah.
And feed the baby.
Yeah.
Or supplement.
Or supplement.
Yes. So that you see, after now that you have seen what you're giving this baby, like now you know I'm giving you 20 meals.
Yeah.
I've given you and I'm sure now you have taken. So will I get something after that?
If I don't get something?
Now after that we can go to the hospital. Another thing, when we are feeding, we keep saying, mothers keep thinking they don't have enough milk.
Yeah. Yet they have
enough for them and excess for the baby.
Yeah.
Because like the first day, we only need 1 teaspoon. That is about 15 meals.
1 teaspoon is like 10.
Around 10 to 15 meals.
Yeah.
And this is the size of the stomach.
At birth.
At birth. That one. And this is the color of the stool.
Yes.
At birth. From there, 2 to 3 days.
The baby is now started feeding.
And now the mother is eating well.
The stomach is expanding.
Expanding, yeah.
So it has changed in size. Eh?
So as the mother is getting enough milk,
yeah,
the stomach is also enlarging.
Yeah.
Can you see how God has His own way of doing things?
Yeah.
Like the first day, most mothers have very little. Second day, very little.
Yeah.
By that day, our baby's stomach goes to this size. And this size is about 20 to 30 meals of milk.
So you have enough. Don't say you don't have enough.
Yeah.
Milk.
So if this is the color of the stool.
Yeah.
Then from there, now we are 4 days and above. Our stomach has grown.
Yeah.
Now you mom, you're able to feed. You're almost recovering from that. You have excess milk. Our stool turns to yellow, and our stomach becomes big. So we are off. Okay, this is meconium. Those are meconium.
And then now this one, because there is food, there is milk.
Yes.
It has changed color.
Yeah.
Okay.
So that is it. You can see how God has His own way
of doing things.
Yeah,
it's interesting.
Very, very interesting.
Yeah. So we were talking about a baby who is active. How can you tell a baby who is not okay through checking the activity?
I always recommend like have connection
with your baby.
Yeah. So if you have your connection, like when you are changing, always talk to your baby.
Sing to your baby.
Hi.
They can hear.
And once they hear, they are able to respond on their own way.
Yeah.
Like you'll see they open their eyes, they smile, they stare at you, because they are used to your voice from the tummy.
Exactly.
Yeah.
Just that they can't respond back, but they can really hear what you're telling them, and they'll reciprocate by maybe smiling, following you.
Yeah.
Yes.
And even like when you are changing diapers, they try to resist. And kick you.
Yeah.
But if you find your baby the baby is just floppy, it's just lethargic,
no movement of the legs and hands.
No, there's a problem.
You
seek medical advice.
So next, Mary, the next point, there's a lot to check on the baby. And our next point will be maybe skin. What do we check on the baby's skin?
Oh, yeah.
You see, we are used to, when I have a fever or the baby has a fever, what do you do first before you use a thermometer? you feel the skin with the back of your hand. So the skin can tell a lot. The baby's temperature
is between
30, anything above 70, that's 7.3. That's 7.2, that's 7.3.
Pardon?
We can say temperature of the baby.
Normal baby.
Yeah.
A normal baby is 36 to 37.
Yes.
So anything above 37
and above, that is,
you need to keep thinking. That is why I'm always saying it's always good if you're always in touch with your baby. That's the only time you can be able to tell.
Yeah.
Today you feel warm.
That warmth is too much.
It's too much.
Yeah.
Then now we have gone to a digital world.
Yeah.
Most mothers these days, you find even they have thermometers.
Yeah.
So just check and confirm.
Yeah.
From there,
you can check on the skin and you see many things like even rash.
Yeah.
If a baby has a rash, you can differentiate. Is this rash okay? Does it need to be checked?
Yeah.
Like, how can we differentiate a normal rash and a rash that needs a medical attention?
A normal rash is just small rashes all around. Maybe like you find they are in certain points.
Yeah.
They can happen because of over covering the baby.
Yeah, the heat
Some
rash.
of us mothers, we are very overprotective. You cover, it's hot. This is a small human being just like you. Don't overdo, don't cover. If you are not putting on a sweater, why are you putting a romper, a sweater, a vest, and so many things, and overlapping the baby?
Yeah.
Yes, you'll overcover the baby than you're covering yourself.
Yeah.
But if it is a hot day,
consider the baby also.
Consider the baby.
Do not overdress the baby because they also feel the heat.
Yeah. So you get some lashes, mostly on the neck region.
On the back, because they lie on the back.
Yeah.
And on the groin.
And on the groin.
Yeah.
And also, like, sometimes you can also find some babies get nappy rash.
Yeah.
Or diaper rash.
Yeah.
So you should always change your baby after every, like, don't let the baby stay long with a diaper.
Exactly.
Because they get those diaper rashes.
Yeah.
Another thing that may cause, you may have some infection, you find like small rashes with pus.
Yeah, the whitish
substance.
Yeah.
Those ones, you need to seek medical attention.
And most babies are born with it, by the way. Yeah. Or maybe can a heat rash change to be septic or to be infectious?
Yeah, sometimes.
When it is not attended.
When it's not attended to.
Another point about the skin is dryness. You find that some babies have a very dry skin. It happens because maybe when a baby was born, the baby was post dates.
Yeah.
I would call it the baby was past 9 months. So they tend to peel. Peeling is normal, viewers, but in case the peeling and the dryness is too much, you can decide to use some mild moisturizers for the baby. Just moisturize the skin and avoid using very harsh chemicals on the baby's skin.
Not only on the baby's skin,
but
also even when washing the baby clothes.
Yeah.
Always use mild detergents.
Yeah.
And rinse them well.
With a lot of water.
With a lot of water.
Yes.
Yeah.
Any addition on the skin?
I think we have like covered the whole skin.
But I can add on the dehydration part.
Oh yeah.
Yeah, the skin is also able to tell you if the baby is dehydrated. Okay, there'll be dryness, yes, but dehydration comes like the baby's skin. If you pull the baby's skin, does not go back immediately. What do you call that? The elasticity.
Yeah.
The elasticity of the skin has been affected by the lack of water in the body. So it is a good sign of dehydration.
Like if you look at Ivrin's skin, she's very hydrated. It's just you pinch, it goes back immediately.
Yeah, for a baby.
Then also you find like if the baby has not fed well and you also find the sunken anterior fontan. This part that bumps.
The opening.
This opening. You know this thing that you feel like you want to touch,
but it is pulsating.
It keeps pulsating.
Yeah.
It goes. Most of the times it's usually upward, but now it forms like a saucer shape.
Yeah.
Okay, now that's a baby to be taken to the hospital.
Yeah, because that is a baby who is dehydrated, and remember, dehydration.
Dehydration is
a
bad.
thing.
It kills.
It kills babies.
It also causes renal failure on the babies.
Imagine a baby on dialysis because of not feeding, because of something you could have avoided. So in case you see a baby who is not feeding well, it's good to act. We have a point that most of us, especially first-time mothers, get afraid of.
Where? The cord.
the
snake.
This part of the banana.
This one. Normally, there's the cord that we cut and leave about. There's a stump.
Yeah.
It looks more like
a wound.
Yeah, a wound, and then something dry hanging.
Yeah.
Most people are given the baby and they never touch.
Imagine.
That thing. They never take care.
Yeah.
That is one of the most, it's one of the things that cause infection on the newborns if not well attended to.
Yeah.
So, what am
I supposed to do to the cord?
Whenever you're being discharged, you're shown how to clean the cord. And I think we should do that one as a class.
As a video on its own.
Yeah. We should just show them where you just swab with a cotton wool from top to bottom.
Yeah.
Using
spirit and cotton wool.
Yeah, you can use spirit depending with whichever hospital you are from.
You'll be guided by the health provider.
Yeah. Some will tell you even just do soap and water, but the place do remain clean and dry.
Yeah.
So the greatest thing is to notice that there is no infection around the area and maintain the cleanliness of the cord. How long does it take to fall off so that you form an umbilicus?
Yeah, I think it takes like the first week.
It falls off within 7 days.
The first week, it should fall off. But when you see it's not drying up, it's not falling off,
then
it is smelly,
then there's a problem. So you need medical attention.
So guys, kindly tell us, is there anything maybe we've left behind that we should have told you, or maybe something you'd like to add as what we are supposed to look out on a neonate after the baby has been discharged?
Also, kindly viewers, tell us from where you are watching from.
Yeah.
What do you use to clean baby's cord?
Yeah.
I know there are many things. There are others even who use the
soil.
The soil, no.
Don't use soil.
Don't use soil.
Yeah.
Don't use saliva.
Yeah.
So what do you use? What does the hospital where you delivered your baby, what do they recommend? Tell us.
Tell us, how long did your baby's cord take to fall off?
Yes. As we meet on the next video, we talk more on how long and how to take care of the cord. Bye.
See you in the next one. Bye.
Remember to subscribe,
share,
comment. Bye.